Right, so welcome everybody. We've got lots of attendees out there, so I'm so thrilled that you're joining us on this 1st of June. My name is Cindy Meserly, and I'm the CEO of the Lupus Foundation of America, Philadelphia Tri-State Chapter, and I'm pleased to welcome you to the Chapter Network's Let's Talk About It webinar. I hope you're all well rested after this Memorial Day weekend, and as Dr. D and I were just talking about, if you're in the Tri-State region or even the Northeast, it was a rather wet one, so hopefully your area was a little drier. And the Tri-State Chapter represents Pennsylvania, South Jersey, and Delaware. So if you're joining us from around the country, we're thrilled to have you here for all the chapters around the country. So if this is your first time on the Let's Talk About It webinar, each month the Chapter Network gathers together to discuss important topics related to lupus from experts across the country. Tonight we'll be discussing lupus and oral health. This has been really an in-demand topic for a while now, so we are delighted that we can bring our speaker to you tonight. Today is the first day of June and also the first day of Oral Health Month, so we thought this was rather appropriate that Dr. D could join us today. And as you all well know, this topic is crucial to our lives, and proper oral care is essential to good health, and it affects so many different things in our body. As lupus can affect any part of the body, the mouth is no exception. Painful ulcers, dry mouth are all too familiar to some of you, I'm sure, on tonight's webinar. So before I introduce our presenter, just a quick reminder that the information provided in this webinar is for general information and educational purposes only and is not a substitute for your physician's advice. The views expressed by this webinar presenter the views expressed by our webinar presenter are those of the presenter and not necessarily the Lupus Foundation of America. So with that, I am pleased to introduce Dr. David D. Giolorenzo, who I am going to call Dr. D. Thank you, Dr. D. Dr. D received his training at the University of Pennsylvania in the Department of Periodontics and Periodontal Prosthesis. His training included, and here's a mouthful, a bunch of words, everybody.
Yeah,
prosthodontics, you'll tell me how I do, Dr. D. Prosthodontics, orthodontics, periodontics, and advanced oral reconstructive techniques, including oral implantology. He is in private practice in the Pennsylvania towns of Collegeville and South Williamsport, focused on laser, aesthetic, and reconstructive periodontics, dental implantology, advanced reconstructive case management, advanced immediate total tooth replacement, and TMJ, which I'm not even going to attempt to pronounce. Dr. D works with more than 60 referring doctors in the country and treats patients from every state. So tonight's webinar is being recorded and will be available through your local chapter shortly following the program. If you have questions during the webinar, please type them in the chat, use the Q&A. We'll do our best to get to as many questions as possible. And just please note that we can't always address very specific diagnostic or treatment questions, and you may need to follow up directly with your physician following this program with very specific questions. So if you have questions unrelated to tonight's topic or want to learn more about lupus programming, please check out your local chapter on our website. You'll find all kinds of great information. So with that, Dr. D, I am going to turn it over to you. Take it away.
Thank you so much, Cindy. It's a pleasure to be here for this group. And, you know, we wish everyone a healthy, happy, prosperous life. And I'm pleased to be here. So tonight, I wish I could see all of you. We're going to run through some of the components of lupus, which you all are familiar. So I'm not going to belabor the concepts of what lupus are, but I really would like to create an informal environment. And I really urge everyone, we have at the end of the presentation, you can reach out to me or Robert. Please email with any questions. We're here as a resource for the community. It is a complex, myriad, multifaceted diagnosis, as you all know. And the presentation orally, medical, dentally is very, very complex. It is a lifetime of management, and it leads to a lot of very difficult decisions for you personally, and also for the clinicians and doctors that treat you as well. So we're here for you. Please feel free to reach out at any time, any moment. And so we're going to kind of get started here and move this presentation forward. And let's see if we're going to get this moving, let's see, new share. It's odd. Oh, let me just jump out of this, Cindy. That presentation is not advancing. Hold on one second.
Yeah, it was working earlier.
It was. Don't you love that? That's my
Technology is wonderful.
I love to be part of all of this technology. I'm just glad I'm not in a room with 150 people. Thank God.
And if you need to unshare, and I can share for you if that would help.
I think it probably, let me just see. I'm trying to get up here on the, let's see. You are screen sharing, stop sharing. All right, there.
And now it advanced. Okay, you're good.
So there it's advancing. Isn't that interesting? So wonderful. All right, so I'm not going to spend too much time on the actual lupus diagnosis because you're all extremely familiar, I think, at this point with your diagnosis. You've had a lot of dialogue, and hopefully everyone is under treatment. In particular tonight, let's talk about some of the effects. And of course, you're going to be very, very cognizant of many of the ulcers and the intraoral ramifications of these lesions. And I think a lot of the meat of this dialogue is going to occur at the end of the conversation because our goal is to present you with some important treatment and simple remedies, a lot of them very integrative, holistic remedies that will help to keep you comfortable. Quite frankly, there's not a lot of cure for these ulcers, these herpes virus type lesions that may occur in the oral cavity. There are laser treatments, there are therapeutic treatments, which include, utilizing coconut oil to help ease, aloe vera gel, but there are different things. But these oral lesions that you see that affect your life are very, very common in immunocompromised conditions, from lupus to many others. One of the major issues with lupus that I personally have dealt with over the last 25 years is the combination of decay, dental decay, and periodontal disease. So it becomes this trifecta of events that occur, and it seems that you begin to spend so much time in the dental chair. So I'm going to build this story because this story has been very personal to myself and my patients over the last 25 years. And it really leads, as we progress through this presentation, to what are the decisions that I need to make to actively manage the intraoral ramifications of this disease. So, we know that the caries that occur as a result of the ramifications of the disease, the dry mouth, the change in the immunocompromised state, the change in the saliva, all of these things lead to gum disease caries. And in particular, the caries that we see become very difficult to manage because in particular, they occur on the root surface of the teeth in the cervical zone, and that is almost impossible to treat, right? So prevention becomes critical, and we're going to talk about that. As you may be aware, temporomandibular joint and generalized joint inflammation is a huge facet of lupus as we see these immunocompromised, immunocomplex inflammatory mediators circulating throughout the body. And the TMJ joint is not spared that. So we've seen a higher propensity of people with osteoarthritis of the joint, soft tissue dysfunction, and couple that with a lot of the dental disease and breakdown that we see, and you begin to see many of the ramifications. And people often don't know that when you go into a state of dental collapse or breakdown, as you see on this left slide here, when you lose teeth and you begin to lose the vertical dimension of the jaw, it affects everything from your venous circulation to compression of the cerebrospinal fluid to tremendous adversities that affect your health. So the oral health and the craniomandibular complex are absolutely critical to wellness, to balancing your meridians, to circulation, and to cerebrospinal fluid, and how that transmits from the top to the bottom of your spine. So all of this is interrelated. It is not occurring in a vacuum. So we understand that we have medication-induced bone loss from many of the medications that you're taking. It could be steroids and many other therapeutics, the dry mouth, the ulcers, the caries, the periodontal disease, and then we have Sojourn Syndrome, which actually affect the glands of the eye and the salivary glands, the jaw joint. And then we have the susceptibility of increased risks of oral infections, poor bone quality, and then the reactivity to the materials that we as practitioners begin to utilize to restore and reconstruct your mouth. So the effects of lupus on the associated oral system often lead to, as I said, Sojourn Syndrome, which you're all familiar with. I don't have to tell you about this. I'm sure many of you have been diagnosed with this. You have the dry mouth, which affects your IgG and IgA, your immunoglobulins, which are very active in the oral cavity and the front line of disease mediation or prevention. And often we see many patients on drugs to increase the saliva, right? The pilocarpine and the Saligen, these kinds of medicines. But the fact is your IgG and IgA are still affected, right? So it's not going to decrease your risk for disease. That's the important point. So we see these manifestations. We see the cracked lips, the periodontal disease, these oral lesions, lichens planus, red and white sores, usually painless, but nonetheless very uncomfortable and annoying. So we look at, in contrast, so if you have lupus, you may have a whole host of other individual assets that surround lupus. So we could have other disease manifestations, including high blood pressure, high blood sugar. And so you look at this from an integrated perspective and you're on a myriad of different medications. And this really, really deeply complicates the matters. And this is why when we see these cases, it is so important to have a team of practitioners integratively managing your healthcare. And that's a critical point because it is just so important. One of the, as we talked about earlier, really good oral hygiene is critical. And so obviously we know that we must brush and floss. Everyone should know that at this point. And really a balanced diet, right? Low in sugar, keep your diet as basic as it can be. You don't want to be eating an acidic diet. Acids are a precursor for disease. An acidic body leads to disease. So we need to keep our body in a basic state from a pH perspective. We want to avoid, obviously, your soft drinks, your teas, your high sugar stuff, smoking. You want to lubricate your body, take plenty of water. And then there's always the issue of avoiding excessive sunlight due to the photosensitivity from many of the medicines that may be associated with the remediation of lupus. And make sure you're, having your regular dental visits with ideally a periodontist to monitor your overall health condition in coordination with your physician. So your dentist should be a part of your multidisciplinary approach, and that becomes extremely important. Now, one of the other things that we see consistently is a very delayed type sensitivity to many of the materials that we use in dentistry. As you know, we use a tremendous amount of metals historically in the mouth. It may be nickel, gold, mercury. Many of these we no longer use, but nonetheless, it's very important that you look at these metals prior to being placed into your mouth, right? Even if you have a crown place, you need to understand how you're going to react before they're placed, because it can certainly exacerbate a lot of the intraoral lesions that we see clinically, and that will affect you because they're very difficult and painful to manage. It can even be manifest through continued or increased inflammatory mediators peripherally outside of the oral cavity. Another common symptom is your acid reflux for lupus. And one of the great things that you can do for acid reflux, obviously there's some medicines out there, but you can take a licorice supplement. It's eluding me right now, but there are some very good, common, natural methods to effectuate your acid refluxes if it isn't very advanced. That will help. It's a derivative of licorice. I'll be sure to get all of that to you. I'm drawing a blank on the name of that at this moment. But the biting of the insides and the cheeks and the jaw can exacerbate many of the lesions that affect the oral cavity. Now, one of the things that that I think most of the lupus patients, a lot of them that I've treated over the last 25 years, is that there is a metabolic problem, and the metabolic problem manifests in a continuation of bone and gum loss and disease and caries and all of these things. No matter how well you try, it still manifests, and that's a result of the severe metabolic components that affect the human body as a result of these inflammatory mediators that circulate throughout the body. So 40% of individuals with lupus will display gingivitis, painful ulcers throughout the oral cavity, red tenders, bleeding gums, gum infections, cavities, painful teeth, bad breath. All of these things are a manifestation, but extremely important to treat. Extremely important to treat, because the inflammatory components of your oral cavity will increase the mediators peripherally in your circulation and thus exacerbate your condition, the pain, the swelling, all of the factors that you see with lupus. So it's extremely important to get control of these oral health factors in one way or another, because it will absolutely balance the rest of the body. It will reduce the pressure on the meridian systems and will balance the electrical charges in your body, because you are basically an electrical circuit. And without your oral health, you are disturbing much of the electrical vibrations and currents that mediate through your body. So this becomes critical. This just is not a tooth issue. It's an overall health issue. Some of the ways that I would, recommend that you look at treating, if you need to have treatment for gum disease, I would really avoid any kind of traditional surgical approach, and I would look at laser treatment, alternative therapies to conventional treatment, because the last thing you want to do is agitate your body, put it under duress through excessive healing as well. So we always like to recommend a Lannat procedure, basically as a laser-assisted procedure that's used to detoxify your oral cavity in the event that you are diagnosed with advanced or with periodontal disease. It's a much more conservative method to treat and effectuate the bacteria, fungus, or viral components, loads that may affect you. Unfortunately, many people with lupus, and this becomes a decision-making tree, will wind up losing their teeth. And so as you look at it, I've seen a lot of people that have done everything they can over decades to save their teeth. And then unfortunately, they're faced with, okay, I'm going to lose my teeth. What are my options? And the other big facet that this brings up is, do you continue to remediate your natural dentition, or do you move to tooth replacement earlier in the process? Not only for your health, prognosis, inflammation, but also for finances, because I see a lot of patients that have spent decades and a lot of time in the dental chair, and they've spent a tremendous sum of money, and these things just continue to fall apart. So it becomes very disenchanting for our patient population when they've spent so much time and now they're faced with tooth loss. So sometimes it pays to look at tooth replacement, as you see in this slide, sooner than later. There's one factor in tooth replacement. When we talk about orthopedic tooth replacement, we're eliminating the natural teeth in the equation. So what that does is we immediately remove the susceptibility to tooth decay, because when we utilize orthopedic reconstruction, they cannot rot or decay, right? So an implant or an associated prosthetic cannot rot and decay. However, the bone can and likely will continue to resorb even around an orthopedic insert over time. So we have a myriad of different options in tooth replacement. If it comes to that, we have dentures that are supported by nothing, right? You'd have to use paste and cream. We have dentures that are supported by orthopedic replacements that are either clip in, clip out, or fixed in place. And then when we talk about tooth replacement, we have a multitude of different materials that we can use in the oral cavity. Not every clinician nationally is adept at talking about zirconium or metal-free dental implants, but certainly you want to avoid metals when you can. Metal-free dentistry is a much better approach for people who are immunocompromised. There's less interaction with the immune system, and they're more highly biocompatible for the gums and the adversities that we can see with metal placed into the human body, right? So in particular, titanium. So in a situation, to reiterate, where you do need tooth replacement or you need bridges, I would make sure that you are utilizing a metal-free product. So one of the ideas that we alluded to earlier was when you get to a point where you have to replace your dentition, you want to consider retaining versus replacing, and look at and dialogue with your doctor on the cost versus the prognosis, right? So you don't want to have to necessarily do this over and over and over again in your life. So sometimes it may be more effective, not only from a prognostic point of view, but from a financial point of view, to move towards a certain avenue faster rather or sooner than later. Root canals, caps, and crowns under ideal circumstances do not last forever. And certainly in our lupus population, they will not last forever. Dental implants likely will lose bone as well over decades, and they may not last forever. So again, I get back to this cost versus prognosis, and prevention is really the key. The key is preventing. And so some of the things that we need to understand is that, guys, when you have a cavity, the death spiral of a dentition or a tooth is that we've all had cavities. We started as a child. We then moved to a cap. Then we need a root canal. And at that point, the tooth is guarded, right? Many people don't know this, but then the next step is an extraction. And then the next step is either implants or dentures. So we call this the death spiral of a tooth, and it's an unfortunate series of events, but it is a known and an eventual sequela to all of the therapeutics that we as dentists and specialists deliver. So one of the things you can do to enhance, so what do we have to do? What do we have to think about in this patient population? Because you're more susceptible. You are more prone to breakdown. But when you need to have a tooth extracted, when you need to have something therapeutically, you need therapeutic intervention, what do you want to think about with your practitioner? Where do you want to look? You really want to begin to think about utilizing growth factors or stem cells to help accelerate your healing. The other thing we love to do is use ozone therapies. Ozone is injected. It's a hyper oxygen molecule that accelerates healing. And this is injected into the site in your oral cavity and really helps to facilitate the vasculature to facilitate healing quickly. Because with lupus, you can be prone to adverse healing effects: slow gum healing, slow bone healing, painful healing, inflamed healing. So the last two modalities that are excellent are laser biostimulation, where we're utilizing a laser to accelerate the healing of the site, and that can be done at the time of the procedure, a day later, weekly. And then the other thing that we really love to do is consider hyperbaric oxygen before and after treatment to help supply blood to the surgical site, the extraction site. And in the Northeast, it's not as common for people to be able to find little spas with hyperbaric oxygen chambers. In different parts of the country, you can go to literally a spa, they'll have a chamber you can get in, and it's like $85 a treatment. But this is critically important to help you heal quickly, effectively, and painlessly, because the whole key is to do things and to heal without adversity. Now, we believe in a biohealth protocol, extremely important. I'll talk about elements of this. My goal isn't to get extremely detailed. Every human being is extremely different, but across the board, we like to see our susceptible patients on a high-dose vitamin C, a high-dose probiotic, a phospholipid vitamin D3 with a K2, which is nattokinase. Essentially, this becomes a hormone, vitamin D3, K2, sublingual under the tongue. We want to keep those vitamin D levels above a 60 reading, right? Anything below that, our immune function can be compromised. CoQ10, B complex vitamins, and glutathione. So what I just showed you can be oral every day. The other option is to consider this all through IV nutrition. So you're doing an oral protocol, and then once a month, you're doing an IV boost where you can have a drip bag of nutritionals run through your veins, run through your body in about 1 hour. But the biohealth protocol is extremely important to help manage your overall approach. Some of the things that I really like to recommend for the dry mouth, for the caries and different things are coconut oil pulling. It's fantastic. Just take a teaspoon of coconut oil, put it in your mouth as many times a day as you want, let it dissolve, keep it in there up to 1 to 3 minutes, maybe longer, but just let your oral tissues, the teeth, bathe in coconut oil, organic preferably, and you're gonna have a tremendous opportunity to keep the oral cavity lubricated, the tissues comfortable, and it also draws out bacteria and toxins. The other thing that we discussed previously was a systemic probiotic, which you can take orally, and it will help effectuate the flora that live from your mouth to your GI tract. But we have some oral probiotic mints on the market called Probiora. And these are mints that you can suck on as much as you want all day, extremely effective, and they will help not only boost the immune function, but balance the bacterial population of the mouth. So there's another paste and cream that we really like. However, it does have gluten in it. Many of our patients are gluten sensitive and don't want to use products which contain gluten, but it's called MI paste. You apply it every night after your home care protocol, and it has a product called Recalcident, which binds calcium and phosphate and helps to rebuild the surface of the tooth. This is particularly important for the decay that occurs along the gum line of the teeth. So these are extremely effective modalities to help manage this. Some of the other components are looking at an anti-inflammatory diet, CBD and cannabis as a sublingual tincture under the tongue. And again, bathing the mouth in CBD in MCT oil, which is coconut oil, is very, very effective at managing dry mouth, providing a vegan source of fatty acids, not necessarily from a fish source, but from a plant source, which would be the cannabis plant. And then for management of overall inflammation, the infrared sauna is very good. And then, of course, we have immunotherapy, which is a very effective treatment as well, which you can talk to your integrative healthcare practitioner about as well. So at this point, I think I've spoken enough. I'm going to answer some questions, and then I'll thank Cindy and the whole team. And if there's questions, again, anybody who'd like to contact us, feel free to reach out to us at DMD. Cindy, can you send out a contact email? I thought Robert had included it into a slide here, but I don't see it for the crew.
Of course, where would you like to go?
Just dmdseminars@aol.com. If they'd like to put that. So anyone who has questions or, could just simply shoot an email. We're happy to help you to respond and share some information, get you on our email list, that kind of stuff. So without further ado, I'm going to turn it over to Cindy to moderate any questions or concerns.
And we do have a few, and these are two really good questions. One question is shared is, I have $15,000 of dental and periodontal work to be done. I go faithfully every 6 months to my dentist. Since I've been told by both physicians that it is secondary to disease, is or will be able to be billed under medical versus dental?
Yeah, that's a great question. And, we've been grappling with that for many, many years. My office staff has worked to get them to acknowledge that systemic diseases such as lupus affect the overall oral condition, right? And the vice versa. It's a two-way street. I would say that is not a quick answer. What you have to do is have them investigate your medical carrier, call your medical carrier personally, and talk with them and see if they will allow, if there's any clause in your claim for them to consider this as a result of a medical condition. And I think if you do that, you may have some luck where your provider can then bill it to your medical provider. But you certainly need to do, I would say, a preliminary pre-authorization of dialogue and open that dialogue box with them. And I hope that answers your question. So it's not a clear-cut answer. I have had patients where their medical has covered procedures for dental that were related to your medical diagnosis.
Okay, good. So here's an important message, is that we all need to be our own advocates, right? So it's really important to, even if the physician says, no, he doesn't think, you have to actually make that phone call and make sure that you're getting through. And sometimes it's not taking no for the first answer. Sometimes that's an easy answer for the insurance company. So stay on it, be your own advocate, that's for sure. And along those same, good. Yeah, along those same lines, another viewer, participant here shares, because the financial impact of this work, and we all know that dental insurance is not always so great, as you well know, Dr. D, right? Are there any known or available financial resources that you've come across, Dr. D, as far as for those that are living in this dental nightmare, as our participant shared?
Yeah. I think that's a great question, and it really becomes such a hardship. There's two options for that. If you can't treat in a private practice setting and deal with the known functions of that, where, there's financing and this and that, then I would say going to either, in the tri-state area, we have University of Pennsylvania's Graduate Department in Periodontics, Temple University's Graduate Department in Periodontics. are really great resources for the community that will allow you to treat with our graduate students who we know and trust, but at a greatly reduced fee. So, you know, it's not a fiscal derivative. It is an opportunity for you to have your therapy in a teaching environment. So it comes with, you know, a different cost basis. It's not free, but it completely looks totally different than what it would be in private practice. Outside of that, I don't know of too many. And Cindy, you could tell me if, you know, individual organizations set up funds, you know, foundations to help facilitate that. I haven't come across too much of that.
Yeah, there aren't too many that are specific to lupus. There is one called the Health Well Foundation. And fortunately, I think their lupus funding is closed at the moment, but I will double check that for everybody. Yeah, it's a challenge, that's for sure. But you bring up a good point. We in Philadelphia are very fortunate to have some major teaching institutions and medical schools and dental schools, as I'm sure other major cities are around your region. So, you know, if you have questions about your local area, don't hesitate to reach out to your local chapter. Many of our chapters have local connections to medical schools and physicians and may be able to give you a strong referral there to one of the local places. So great point.
Great point. Yeah. And don't stop. I think Cindy's point of being your own advocate, I would not stop. I would continue to turn over every leaf that you can.
I'm telling you, the questions are pouring in. These are great. Any tips to help with bad breath?
You know, bad breath, I would say it depends if the bad breath is coming from the oral cavity. There's something called chlorophyll that is in every green plant. You can order it on the internet or a health food store. If it's a systemic source, you know, typically bad breath can emanate from the liver or the stomach. And I would urge you, if your oral health is, you don't have periodontal disease, you don't have cavities, you're not in a state of disrepair, then you may want to try chlorophyll. It comes in a bottle. It's a liquid. You can place it, you know, every day you drink it. So you'll swish with it and then you'll drink it. And I would do chlorophyll for like 30 days and see if it affects the halitosis. Of course, locally, you want to brush your teeth. You want to use all of the things that we discussed. I would try to avoid anything with alcohol in it, any breath freshener with alcohol, as that's going to desiccate or dry you out. And I would try to stay more holistically bound to products that are going to look a little better. But as far as the bad breath, that's a tough one, because if it's really coming from the oral cavity, then you need to remediate the source of infection. And that means, you know, whether it's extraction or laser therapy, you know, that's certainly the most ideal option. But get in there and use your Sonicare, use your water pick, use all of the known methods to help. And in your water pick, you could add some hydrogen peroxide as well.
Oh, great tips. I hadn't heard that before. All right. What about chlorhexidine mouthwash for active inflammation and infection? Do you recommend?
Yeah, I mean, for the lupus patients, if you have a lot of mouth sores, I really don't recommend Paradex. And the other thing is if you're susceptible to caries or cavities, it's going to stain your teeth. It will not help the mouth sores. So I really don't want to recommend Paradex as an inflammatory component for as a remediator for inflammation in the mouth long term. It could be used very short term on a Q-tip and swabbing, but I would avoid rinsing with it. If you're missing all your teeth, fine, you can rinse with it. But if you have teeth and you don't want them to turn black and dark, I wouldn't trust Paradex long term at all. It also has a lot of dyes in it, different ingredients that you can be allergic to, and can promote your ulcers and sores and actually make them worse.
All right. Good to know. See, these are why you guys are asking great questions. This is information we all need to know. What are some of the long-term effects of untreated TMJ? Someone's addressed a concern where she's had it now for 6 or 7 years and her physicians don't seem to be overly concerned. Should she be?
Yeah, that's a great question too. You know, TMJ, if you have clicking in the jaw, it's not necessarily pathologic. It's when you begin to experience pain, and then limited jaw opening where you just can't open your mouth effectively and it starts to affect your life. Then it becomes a situation that you want to treat, right? So it just, again, it depends. Number one is the diagnosis. Is it in fact TMJ? You know, clicking of the jaw joint isn't necessarily TMJ. But when you begin, again, I'll reiterate, to experience limited opening, difficulty eating, pain in the jaw joints, pain in the neuromusculature, then that really becomes extremely debilitating. And just like osteoarthritis or any other joint-related condition, it will affect you. Now, for that, I'll comment MSM is a great nutritional. It's a sulfur-derived compound, MSM. Mike, you can look it up, along with chondroitin sulfate, and it's going to be the best nutritional to treat the TMJ joint.
Oh, good to know. All right. Early in the presentation, you mentioned something about vertical bone height affecting circulation. Was that correct? Do you want to just clarify that statement?
Yeah, let me clarify that. So I said, when you begin to collapse and lose teeth. So as I sit here and I bite down, I have an intact dentition. When I begin to lose teeth, a lot of this lower third of my face can collapse. It will collapse. As teeth are lost, this collapses, right? And it begins to compress the jaw joint relationship here in your TMJs. And as it further collapses, it will affect the circulation and the cerebrospinal fluid. So it'll affect the circulation in the posterior cervical area of the carotids and the venous return. It'll affect the composition of the cerebrospinal fluid and the free circulation of it. So it has a myriad of effects. It's not related to the bone loss, it's related to the tooth loss and basically the collapse of the dentition. So you're under a lot of what we're going to call in general terms compression.
Thank you. Thank you for clarifying that. Boy, I'll tell you what, who knew so much was surrounded around your mouth, right? When things are bad, we know it. When things are okay, we're not usually paying attention to all that goes on. What about just a salt water rinse for mouth sores? Do you find that helpful?
I do. I think the salt water is a great method. I would just make sure the water, isn't loaded with fluoride and all the chemicals that can be in the municipal water supply, lead and heavy metals and toxic substances that, again, will exacerbate your condition, on the lesion. So make sure the water, if you can use distilled water with the salt, that would even be better. And maybe just warm it up a little bit.
All right, distilled water, good, inexpensive options. We like those. How effective is a night guard for TMJ?
I think a night guard can be extremely effective. I tell a lot of patients that call, they think they have TMJ, go to the CVS, grab a night guard for $37, try it, put it in. If it remediates the symptoms, you confirm the diagnosis, right? Wear that. And if you need to see a dentist, then come to the dentist. It'll cost about $500 or $600 for a night guard or an occlusal orthotic appliance. But I always start out by saying, let's see if you can be your own health advocate and solve this problem.
And sometimes doing that very inexpensively is a very helpful thing, that's for sure. Okay, now I'm in the chat seeing that, and we will share the presentation, your local chapter. People are asking if they could have your presentation. We will share that through your local chapter. So watch for an email follow up from your chapter where you registered through. Let's see, we talked about mouthwashes. I did put in, Robert, thank you. I did put in the chat for everybody, the actual name of the licorice. And I'm not even going to attempt to say it, but it is in the chat.
I love him. Thank you.
To treat the acid reflux.
Is the nutritional that is excellent for acid reflux. It tastes like black licorice. You chew them up You can eat them all day long, and they will really be very effective as Zantec or Prilosec. They should be, but try them. They're natural, and they may not have the unwanted long-term side effects. The issue is to just try to solve things simply and naturally.
Are there any, one more here. What about a burning tongue? Anything special to do for that?
Yeah, I mean, burning tongue is a complex diagnosis. There's hormonal ramifications, there's vitamin deficiencies, there's, so these, it could be medical, like metal sensitivities. So, they're complex, but burning tongue really requires a really intensive analysis of your blood work, of, your oral condition, to really A, diagnose it, and then to B, find out how you can remediate it. But I would start with trying vitamin B, the B complex. I would look at the hormonal profile and see what's going on there. And then I would look at any kind of metals that are in the mouth that may be, a delayed immune sensitivity reaction. And I would do an elimination process. So I would look at eliminating certain things from your diet, keeping a list, and taking out, say, your toothpaste, change your toothpaste, change your mouthwash, change your diet, take out carrots, take out this, take out that, add them back in, and then keep it all on record and see what is helping it and what makes it worse.
Yeah, a key point there you said is keep a record of it, right? Most of us don't remember what we had for breakfast. So keep a log, and that's actually really helpful with anything that you experience with lupus or any related autoimmune disease for any of your physicians. Keeping track of your symptoms, what you've done, how that may have remediated any of your symptoms, because that's really important information for everybody to know. And this next question may get a little bit too diagnostic, so feel free to push back. This person has had lupus for 14 years and gets Zometa infusions since 2012. She now has a significant tooth pain. The surgeon does not want to do oral surgery. What would be the next step? Her pain is getting worse, and she's had 4 other teeth that have already had root canal. And our current painful tooth is the wisdom tooth with baby teeth attached to it, like it's an abnormality. Well, that's an interesting question.
Oh, it is. So you're yeah, that's not a quick answer. But yeah, the question I have is Zometa for what diagnosis? Is it for metastases, myeloma? Is it for bone dysfunction? What is the Zometa for? What's it being used for?
She doesn't say. I'm assuming it's lupus, but if you would like to add that in the chat, Anna, please feel free. But in the meantime, I do have another question so we can get maybe some more detail on that. Are there clinical trials and things like that in your field for specifically people with lupus and oral health issues? Do you see that in your field?
As far as new medicines or?
Yeah, clinical trials, studies, research projects. Obviously, the lupus affects so many different parts of the body.
I haven't seen a whole lot. I have to be. If you do a medical review search in the dental literature, there's not a whole lot out there as far as research and understanding of how it affects the oral cavity. Obviously, I'm telling you based on 25 years of experience, what I've seen, but I don't think there's a whole lot of literature-based evidence to support this. But I would say, going back to the Zometa question, if you are taking that as a biphosphonate to increase your bone density, there is some definite risk associated with the adversity in healing. And that's where, you can have your teeth extracted, but you need to understand, you need to look at some of the therapeutics that I said, using stem cells, using hyperbaric oxygen, using the ozone, using the laser, so that you heal correctly, because those medicines will adversely affect how you heal.
Mm. Very valid point, which sounds like why our doctors probably don't want to do it. That's for sure. And we've got one last question before we wrap things up. What are your thoughts on Prevident 5000?
Yeah, I mean, look, I think Prevident 5000 as the MI paste with the recalcitrant are two things that, introducing the fluoride ion into the superficial surface of the tooth is not a bad therapeutic option. I don't want you to swallow it. I don't want you to ingest it, but certainly the Prevident 5000, I would probably move on to the MI paste as a more effective therapeutic to help reconstitute the soft tissue, the hard tissues of the tooth. So I don't mind Prevident 5000, but I prefer MI paste.
Okay. And the last one snuck in here. My periodontist says I need a sinus lift before I can get my tooth implant. I never heard of it. The tooth was pulled last May. She has lupus and Sjogren's.
Yeah, again, I think a sinus lift is a very common procedure in the dental arena. So it's not something that's unusual. Just make sure you're being treated by an oral surgeon or a periodontist when you're having those sorts of procedures, and really sit down and look at, I would have your blood level checked to make sure that your vitamin D is where it should be. That's critical. And I would do the biohealth protocol that we presented with the high dose C. And I would see, based on how your tooth extraction went, if you healed really well, then I would plan on utilizing that same approach during the sinus lift. But the sinus lift is a common procedure. It's very predictable. It's designed to build a foundation for future tooth replacement.
All right, good stuff. Oh my gosh, this hour has practically flown by. So it looks like we've gotten so many questions tonight. So Dr. D, thank you so much for your time and addressing each of these individual. We hit so many different points that just added on to your presentation. It was really terrific. So I can't thank you enough for joining us today. It really has been informational and helpful. As a reminder, this program has been recorded and will be available through your local chapter in the coming days. So just give us a little bit of time to download it and get it loaded up to our websites. And we'll be sure to share the slides from Dr. D. So again, Dr. D, thank you. I learned a ton tonight. I hope you all have taken away a few good nuggets, as I know I have, that's for sure. And just be sure to tune in next Tuesday, June 8th, for our next Let's Talk About It webinar, which actually, ironically, is about bone health and lupus. So we're staying in the bone field for June. So Dr. D, have a fabulous night. Thank you again. Everybody have a wonderful evening.
Cindy,
stay well.
It. I hope everyone is well and stays well. Thank you.
You take care. Take care, everybody. Thank you.